This is a special edition of News 8 Coronavirus Facts First Town Hall.
Good evening, everybody. For the next hour, News 8 will be putting the facts first, taking your COVID-19 questions, and we have received a lot of them, and putting them to our local leaders. A lot to get to, so let's get right to it. We're going to first start with an introduction. Joining us tonight, we have Monroe County Executive Adam Bello and our local Congressman Joe Morelle, and we also have the Monroe County's Health Commissioner, Dr. Mike Mendoza. We're going to start off with some brief remarks to start all of this off, and we're going to begin this evening with County Executive Adam Bello. Mr. Bello.
Well, thank you, Adam, and good evening. I'd like to start by thanking the hardworking team here at WROC and Adam Chodak for hosting us tonight, Dr. Mendoza and Congressman Morelle. We are continuously grateful for the opportunity to get out information important related to COVID-19 and answer many of the questions on the minds across our community. It's hard to believe, but I've been on this job here as county executive for just 3 months now. When I came into office with a strong belief that in order to better impact the challenges facing our community, it was critical that we start bringing people together and finding ways to collaborate. What I have seen over the past several weeks is a validation of that belief. There has been a remarkable coming together across our community. We have our 2 incredible hospital systems working together as one, our hundreds of dedicated nonprofits working together as one, our law enforcement personnel and first responders working together as one, all to ensure our community is able to come through this challenging time together, and I want to thank them. But I also want to thank the other unsung heroes of our community, those individuals working in essential industries that may have been overlooked until current circumstances reveal just how essential they are. Our food prep and grocery store workers, garbage collectors, bus drivers, and the janitorial and support staff at our healthcare facilities, among many others who are all now thrust onto the front lines as well. All of these groups are working around the clock, while many of us are asked just to stay home. So tonight I have a challenge for all of you. I want you to stop thinking about being stuck at home and start focusing on how you are safe at home. That simple change in mindset is how we are going to get through this and how we can thank everyone still called to service. Now, I recognize that safe at home can still be difficult, both financially and emotionally, for all of us, which is why we have a number of resources available to help and get you and your family through this time, and you can find those resources by visiting www.monroecounty.gov. Tonight, I'm looking forward to answering your questions about those resources, the challenges we're facing, and how we are going to get through this together. Thank you.
Mr. Bello, thank you for the initial message and for being here. This is going to take coordination at the local, state, and federal level. Speaking about the federal level, we have the stimulus package coming in and so much more. Here now, Congressman Joe Morelle with his opening remark.
Good evening. I want to thank Adam Chodak and the entire team at WROC for hosting us tonight, as well as County Executive Adam Bello and Public Health Commissioner Dr. Mike Mendoza for their incredible work over the last several weeks, and certainly for joining tonight to answer questions and ensure our community remains informed about rapidly evolving COVID-19 pandemic issues. I also want to express my condolences to everyone who has lost a loved one to this virus and extend my profound gratitude to the many healthcare workers who are working tirelessly on the front lines of this battle to save lives and keep our community safe. We're facing an unprecedented challenge, but we remain committed to tackling it head-on. In Congress, we've taken important steps to provide direct relief for families, support small businesses, and help our healthcare systems respond to this public health crisis. But our work is not done, and we'll continue taking action to uplift our communities and get through this frightening time together. I'm grateful for the opportunity to answer some of your questions during tonight's teletown hall. But for each question, as Adam said, we'll get there. There will be dozens more that we don't get to. So I encourage everyone to continue the conversation, keep asking questions. In addition to the county website, please feel free to visit my website at morelle.house.gov for additional resources and information. Thank you again.
Congressman Morelle, thank you. So yes, this is going to take a lot of political leadership over time, not just at the federal level and the state level, but as I said, the local level. Here at the local level, though, it's going to take leadership at the medical level as well. And to talk more about that this evening, we have Dr. Mike Mendoza.
Thank you, Adam. And I want to add my words of thank you as well to WROC for inviting us this evening to share some important facts with our community. Tonight, I again want to reiterate my gratitude for all of the people in our community who are working so hard to keep us all healthy and safe. There is no question that these professionals are the heroes among us, and for all the sacrifices they have already made, we are still early in this epidemic, and so there is no question we will continue to ask even more of these heroes. And I again want to reiterate, and perhaps stress even more forcefully, the importance of social distancing. Not only to protect our professionals, but to protect the most vulnerable among us who are most at risk. While there are strong indicators that our efforts to implement social distancing are successful, I believe we need to do better, and I believe we can. No matter how the numbers look on a given day, no matter how the trend looks, now is not the time to lose our focus. Social distancing should be our community's top priority. Even though we continue to learn more and more about COVID-19 and how it is transmitted, what has not changed is that social distancing remains the foundation upon which everything else we do will rest. And we cannot rest. We must all stay home as much as possible in what amounts to universal self-quarantine. For those of us who work in an essential job, we should view work as the only exception to that. Otherwise, we should stay home where we are the safest. We have always said that if you are sick, you should stay at home. This is still true. We know that the more symptomatic a person is, the more likely you are to transmit COVID-19 to another person. We are also learning through science that we can be contagious even in the day or two before we become symptomatic. And this is something that I am following very closely, and I am making preparations to recommend universal masking in the community in the near future. We know that the most vulnerable are those who are older and who have chronic medical illnesses. Please take this opportunity to virtually check in on your parents and your grandparents and others in your neighborhood, and please encourage them to stay at home as much as possible. I know I am asking a lot. I am. We are. We are asking a lot because a lot is at stake. We are still early in this epidemic, and I want to underscore in no uncertain terms that this is on each and every one of us to do our part. Thank you.
Gentlemen, thank you. A lot of the questions that we got in had to do with the patients or victims in this COVID-19 outbreak. People want to know more about them. So we're going to start with Barb's question, and she asks this. Have any statistics and/or common denominators been compiled about underlying issues of people who have passed away from the virus? Examples: asthma, diabetes, smoking, and the like. We're going to give this question over to Dr. Mendoza.
Well, thanks for your question, Barb. And we have received many inquiries about the demographics of those who we have lost. And it is our practice in the health department to be very careful about privacy and maintaining respect for those individuals who we have lost. I can tell you that all of the individuals who we've lost have had significant chronic medical illnesses that have contributed, unfortunately, to their outcome. We have lost, as of today, now 10 individuals. The average age of those individuals is 76 years old, and all of them carried the same path toward those final days, the very significant chronic medical illnesses contributing, unfortunately, to the outcome.
The next question is directed to Congressman Morelle. Holly is asking this. I am a small business owner and had to shut down my salon. What is the best way to get help financially during these very difficult times?
It's a great question, Holly. We obviously are getting a lot of questions from people in the community who are in the same position you are. When we began to look at what the stimulus packages would look like, and we've passed now 3, the third being the CARES Act, which is the $2+ trillion package. One of the things that we were really focused on is where previous stimulus packages have always focused on sort of big businesses and how to help them, and we're concerned about their success. What we really wanted to hone in on is how to help families, how to help small businesses, how to help individuals, primarily so that they would have the resources necessary at an individual level to put food on the table and provide shelter. For small business owners, though, this is an extraordinary challenge. So one of the ways, and I suggest you look into this, is the Paycheck Protection Program. This program, which is nearly $350 billion, will provide small businesses, and that would include independent contractors, freelance workers, gig workers who have their own business, to allow them to get a 100% guaranteed loan through the Small Business Administration, and that will cover payroll costs, it will cover health care premiums if you provide health care resources for employees, utilities, overhead in terms of rent, mortgage, debt service, and that program will allow you, as long as you don't reduce headcount, so you keep the same number of employees at the end of this period that the loan covers, as you did at the beginning, it's 100% forgivable by the federal government. So we're working very carefully with our banking community to make sure that they have the resources and you can get the dollars very, very quickly. We're also working with the Treasury Department and the Small Business Administration to make sure, again, that those resources are available. Many small businesses, as you know, work on a very, very tight cash flow basis. So this is a challenge, and we want to make sure that we're successful in dealing with that. For more information on this, you can go to the Small Business Administration, or you can go to the U.S. Treasury website, or go to my website, morelle.house.gov.
County Executive Bello, you might want to touch on that, but I'm also going to leave you with Gina's question, which is this: what kind of non-medical volunteers are needed for COVID-19?
Thank you, Adam. And yeah, I would like to also just thank Congressman Morelle for that, for the work that they've been doing in Congress to provide that support to small businesses across our community, across the country. And in working with the Congressman's team, we have also been able to build a navigator program at Monroe County in our Business Development Department to be able to have our staff available to help individuals who are applying for that, for the small business loans, and through those programs, help them through that application process. So we've been able to work together and build that collaboration through a navigator program. And then layered on top of that, Monroe County has also made available a small business loan program that would offer loans to small businesses of up to $10,000. These are 0% interest loans that can be used on a pretty liberal a range of working capital items that could help a business stay afloat during these challenging times. The payback on those loans doesn't even begin until 2021, and the terms of that are negotiated on a case-by-case basis and can be very flexible. So layered on top of the federal program, the county program, and the navigator program, we can try to get you some help to get you through this. And again, you can access those programs through our website at monroecounty.gov, as well as the navigator program, or you can call our hotline at 753-5555. And the question that Gina had just asked, I think it was Gina, about non-medical volunteers, that's a really good question, and the answer to that is again what I talked about, this remarkable outpouring of support across the county to help people who are in need. And this really goes back a couple years with a new systems integration effort that was led by the United Way, Congressman Morelle, and now Monroe County, to bring together the community-based organizations and nonprofit sector into an integrated model to be able to serve all of those needs at once and the needs of the community without everyone having to go into the scattershot approach. And so through that effort, the United Way, just a couple weeks ago, has opened up a volunteer portal on their website located at uwrochester.org, where organizations have posted types of volunteers that they need, and you can apply to be a volunteer through that portal and be connected. And there's an array of needs out there in our community, from drivers who are needed to bring food to folks who cannot leave their home. Lifespan is looking for volunteers to be able to check in on older residents who are also some of the more vulnerable residents in our community who we need to stay at home, and we don't want them coming out into the community. So Lifespan is a great place to go for that. And Food Food Link as well needs help packing boxes of food and getting food into the community. So there's a lot of different opportunities like that, and they can be done in a safe way to keep you, the volunteer, healthy and the recipient of your volunteer work healthy. And I think it's a rewarding experience as well. Just a couple weeks ago, I had the opportunity, along with Supervisor Dave Seeley, Congressman Morelle, and some other leaders, to participate at a food bank a Food Link distribution at Bishop Kearney High School. And it's something that I think a lot of folks in this community can do, and like I said, you'll find it a rewarding experience to be able to give back and to be able to help those vulnerable people in our community stay in their homes where they are to prevent the spread of the disease.
Very good. County Executive Bello, we thank you. So Gina, you have a lot of opportunities and we have a lot of questions. We're going to get to some of them right after this short break. Stay with us. Nice job, guys.
Are
Okay,
there
take my
free
job.
breaks, Adam?
Yeah.
Is there one at the half hour?
You've had COVID-19. Perhaps once that happens, you can then get back out into the community. But Heather touches on something very important here, and this question goes to Dr. Mendoza. Can you get the virus multiple times? Doctor?
Well, that is a question that is on all of our minds, because certainly we would like to be able to prepare as best as we can for the future. And unfortunately, based on what we know from the CDC, we do not yet have those answers. We do not yet know the full nature of the body's immune response to having received this infection. And so unlike MERS coronavirus, which we knew about some years ago, we do not yet know if this is something that we can contract a second time.
All right, thank you. And this question is for Congressman Morelle. Carol wants to know this. What can you do to be sure New York State gets the supplies it needs?
Well, this is obviously a very big issue. It's been in the news quite a bit. In the CARES Act, which I referenced earlier, which is the third bill that we did in terms of the congressional response to this crisis, we included $4.3 billion for state and local health agencies so they can purchase supplies. That includes tests, it includes personal protective equipment and ventilators. There's also $150 billion in that bill that will go to our hospitals and health systems to help them deal with the unanticipated costs that the virus brings. We're working with private partners, obviously the county executive, the county health director, and others, working very, very hard. We have daily calls with our hospital systems to talk about capacity, and that certainly includes equipment. So we're going to continue to fight for it. One of the things that I am frustrated with has been the administration's slow response to this crisis. Hopefully we're getting to a point where we're catching up. We're very concerned, and we continue to be concerned about ventilators. While it's too early to say, we've been working for the last 2 weeks with folks at our IT and our manufacturing community and others to try to figure out if we have a local solution to the ventilator crisis. Those are things we're continuing to watch for, continuing to look for resources for New York and for our region. But obviously, it's something we're monitoring on a day-to-day basis.
Very good, Congressman. Thank you. This next question is for County Executive Bello. Michael asks this: when our emergency is over, what can your office do to help us maintain more of this collaborative spirit instead of just falling back to business and unnecessary stress as usual?
Yeah, I think that, I'll go back to what I said before a little bit, and that's a really good question. And it's something that I had been frustrated about, I think, in the past, as many people have, is that we have a history in our community of operating in silos and people working about just worried about what is it that I'm doing, what's my day-to-day task, and not really worrying about what everybody else is up to and how do we maximize our efforts to impact the community. What I've seen over the last several weeks has almost been by fire drill, this effort to bring everybody together because we have to. We have to rise to meet the challenge. And working with organizations like the United Way through their systems integration effort that brings people together, I'm on a call almost every day with the leadership of the community-based organizations here about working to bring those CBOs together, which is happening. I'm on the phone every day, including today, with the heads of our hospital systems, working on that collaboration, an effort that really hasn't been done before, but is now a day-to-day operation. Our health commissioner is on the phone with the school superintendents on conference calls. We're bringing people together. I speak to every local government supervisor and county legislator on a phone call every afternoon as well to give updates. And I think what's happened here is it's helped us to build those relationships and to better understand that to rise up and meet the needs of this community, we have to work together. So I think we've been doing a great job doing that over the last several weeks. And my full expectation is, because that's working and we're having that impact that we're hoping to have, that my full expectation is we'll continue to do that in the future. This is about teamwork. Nobody will get anything done on their own. Resources, even after we get through this crisis that we're in today, resources are going to be tight. There's going to be impacts on county budgets, nonprofit budgets, families' budgets in our communities, the state and the federal government. Things are going to get tight. Things are not going to get better overnight. They're not going to get better once we get through the curve, because we're going to have those financial obstacles, the business, the economic impact that this has had across the community, and we're going to have no choice. We have to continue working together for not just the days and weeks, but for the months and years ahead to make sure we come out of this on the other side.
Of course, a lot of what County Executive Bello just said could be applied to the federal level as well. So I'm going to take that question and give it over to Congressman Joe Morelle. How do you assure the community that after this, folks continue to work together?
Well, it is really important, and I appreciate the question as well. I want to commend the county executive. His leadership in the last 2 weeks is unsurpassed, and I have been on the phone with colleagues throughout the last 2 weeks. Now we're doing literal multiple calls per day with folks in Washington and around the country. There is not a community that's working more closely together in a more coordinated fashion than we are here in Monroe County. The county executive referenced the calls we have every day with United Way and a whole host of not-for-profit agencies, from 211 to Lifespan to Action for a Better Community, Catholic Family Center, Food Link certainly, Lifespan, Rochester Transit Service, RTS. I'm leaving many out, but they're on the calls every single day to figure out how do we coordinate, how do we make sure that here on the ground we're addressing those concerns. Also the local calls with all the local officials that we're doing, as well as the hospital system. So this is an extraordinary effort, and I think it says a lot about this community, what Rochester is all about. And I think the county executive, I think the county public health director have just done a tremendous job by leading by example to make sure that we're all together, we're all working in the same direction, we're trying to address issues as they come up, issues that we can address, and we're doing it literally on a continuous basis throughout every single day. And I'm sure that that spirit will follow as well after this crisis has passed.
Very good, Congressman. Thank you. And we are going to address some more issues when we come back. Stay with us. Welcome back. News 8 continues to put facts first when we talk about the coronavirus. We've been talking a lot about the now, which is important. What's happening now? But I do want to go to the future for just a second with Bill's question, and this is for Dr. Mendoza. What can be done to prevent a pandemic in the future? Doctor.
Well, Bill, thanks for your question. There's no question that it would be wonderful if we could prevent the next pandemic. But the reality is that pandemics like these are a part of the circle of life. And to some extent, all we can do is be prepared, do the best we can to anticipate. And that involves research, that involves surveillance, that involves a lot of the things that we do in the local health department, that the State Department of Health does, and certainly the CDC and the World Health Organization. So while we cannot necessarily prevent the next pandemic, I do think that there are very reasonable steps that we can take at every level of government to ensure that we are more prepared even than the last one. And so that is something that my colleagues and I work on very diligently in the health department. We prepare for all sorts of scenarios that we hope, frankly, will never happen. And we also know that we've practiced the isolation and quarantine drill. We've practiced the pandemic influenza drill. And, you know, for better or worse, we've now had to put those practices into action. So, again, while we can't necessarily prevent the next pandemic, I do think there's a lot that we can do to maintain our preparedness.
Very good. Congressman Morelle, Morosco asks about the federal stimulus package, specifically asking, do you have any idea when the checks will come? I am worried so badly about having no money.
Well, it's an important question and one that we're obviously very focused on. As I said, our approach, particularly in the CARES Act, which is the bill we passed just last week, really is focused on individuals, families, people who are out of work because of the virus, and small businesses. So we wanted to address it that way. So the rebate checks, which I think is what's being referred to, is the check that'll go $1,200 per adult, $500 per child under the age of 16. These will be deposited directly into people's accounts if you have electronic deposit when it comes to refunds or pay electronically when it comes to paying taxes. So that will come hopefully within the next couple of weeks. This does include people on Social Security, whether it's the standard Social Security, whether it's the survivor's benefit, or whether it's the disability insurance benefit. So those checks should start entering into people's accounts in about 2 to 3 weeks. We're working very, very hard. The IRS is working with people who are not people in the system currently who will need to file an application. But generally speaking, we hope within the next 2 weeks, 3 weeks, people will start seeing those checks. You do not have to do anything for the vast majority of Americans. Those will come automatically. Obviously, if people, after just a couple weeks, if they're starting to get concerned because they haven't gotten either a paper check or an electronic deposit, feel free to reach out to our office, and we're happy to track that down. But hopefully that'll come and come quickly.
Thank you, Congressman Morelle. County Executive Adam Bello, I have 2 questions for you, and we're going to hit you with the first one first. Darlene asks this: will the children be back to school soon? What about the high school seniors? How are they going to finish their senior year, plus have to do all the tests required for them to go to college?
Yeah. Darlene, that's a really good question, and let me answer it this way. I am also the father of 2 kids myself. They're 8 and 10 years old, and I'm the husband of an administrator who works in a school district. So I am asked this question repeatedly at home, and it's a question that's on the top of the minds in my house, and I think in many people who are watching this today. I want to describe it to you this way. When are we going back to school? When will this all end? And then how do we adjust? First of all, obviously accommodations are going to have to be made. And this isn't just in terms of how we do school, but how we do a lot of activities around our community. We have Easter coming up in just a week and a half, I think it is, a week from Sunday. And we have to think about how we're going to celebrate Easter differently. We're not going to be able to go to church as we usually do. We may not have those large family gatherings as we usually do. We have to think about other ways that we can celebrate those holidays and do so in a socially distant way and in a responsible way that protects our health. We just don't give up on it. We don't not celebrate Easter. We think of other ways to do so. We have to think of the same way when it comes to our children who are in school right now, particularly our seniors who are looking forward to this year of high school for their whole educational career, and now it seems to have gone completely off the rails for them. What we need to do is work with our students and our seniors to find other ways to do those activities, but do them just in a different way. How do we do those senior year activities through remote Zoom sessions? Or how do we do them outside in a way where we're keeping our distance from each other and slowing down the spread and doing it in a socially distant way? But we have to be creative about ways to do that, and we're going to have accommodations made in terms of testing. The tests will not go on as they normally do. Okay, the AP exams I know that just came and went were done in a different way, and the Regents exams are going to have to be done in a different way as well. Because here's the timeline for going back. While I know we try to put timelines and deadlines on things, the real answer is it all depends, and it all depends on what happens with the curve and how well we do when it comes to social distancing. Right now we're reevaluating school closures on a 2-week basis, so I know that the date of April 15th is out there. But while we're still adjusting our modeling, and Dr. Mendoza can talk about this as well, about when that peak is going to come and how big that peak is here in Monroe County, we're still adjusting that. But the best guess that we have right now is that peak is not coming until probably the beginning to middle of May. And if you think about that curve and we're peaking in the beginning to middle of May, you still need to come down off that curve and have a few cycles of the virus coming and going so that we can make sure people are healthy before we can open those schools up again and risk, because we do not want to risk, those schools becoming vectors again for the spread of the disease to come back out. So we need to make sure that the disease is gone and we're down off that curve. And so if we're not peaking until the beginning to middle of May, we really have to start preparing ourselves for that eventuality that schools will not be open here on April 15th, and they won't be open on May 1st. This is going to take an awful lot of time to come through this, and we are probably looking at the end of May into June or even further. So it's going to be reevaluated. I'm not saying the kids aren't definitely not going back to school for this school year, but we need to start preparing ourselves for that possibility, and we need to start supporting, and we need to continue to support our teachers and our school officials who are working overtime right now to provide those educational opportunities, because this isn't easy as well, because what schools are being asked to do now is to convert from just maintaining this relationship with their students and having their students read and do homework and things of that. They're now transitioning into how do we teach our students new content from home. That's the kind of support and space that we need to give our educators so that they can start to build those lesson plans and be able to start teaching again, but doing it again, like I taught at the beginning of this answer, in a different way. But the way we're going to affect this curve and get through this is social distancing. I'm just going to, I know this is a long answer to a short question, but what I do want to say is this, that what Dr. Mendoza said at the beginning of this program is absolutely true. How we're going to get through this and how we're going to get through this on the other side and do it in the best way possible so we don't overwhelm that hospital system is we have to practice good social distancing techniques. This community just recently, if you look at the way we're graded, and there's some websites that grade you on how well you are in turning this down, we were graded an A. I just saw today we've been demoted to a B. We can do better than that, Monroe County. We can be an A. We have to socially distance. We have to cut down, make sure that we're doing this in a responsible way, staying home if you don't need to, and only going out for those essential tasks that you need to go out for. Now is not the time. Now is not the time to start letting up because we're tired. Now is the time to stay home because it's safe. Now is the time to double down on our social distancing efforts so that we can get back to school, we can get back to normal, and we can do it in a way that does not overwhelm our hospital systems and that we protect as many people and the health of as many people in this community as we possibly can.
Very good. And I do want to note that tonight here at this town hall, our leaders are at least a Bill Maley apart. Bill Maley being an exceptionally tall supervisor in our area. Safety first. We do have that second question for County Executive Bello. We're going to get to that in a moment right after this break. As we said, our next question here, as we put facts first, is going to County Executive Bello. And County Executive, I have to tell you that Jill's question echoes a lot of the concerns that I'm hearing out there, especially this week. Governor Cuomo has repeatedly raised the prospect of moving upstate resources, talking medical staff, equipment, and gear, to New York City. Have you received any heads up from the state that some might be taken from our area, and if so, when?
Well, I've had conversations with the two local hospital systems about this very issue, and they have had conversations with the state about conceptually what something like this would look like. But there's a few different considerations that have to be made when you're moving resources around in a pandemic like this. First of all is our hospital systems have been working for the last several weeks. We've made some announcements about this, about their surge planning capabilities to be able to build capacity within their systems to handle what may be coming and is likely coming over the next several weeks and months. And in building that capacity, they've built capacity. Their numbers are down, the number of folks coming in the ERs is down, and they're retraining a number of their clinical staff to be able to handle this. So what ends up happening is when these requests comes in, the considerations you have to make, understanding that condition, is for the staff that does have that capacity to be able, because there's some, for lack of a better word, downtime right now, to be able to train for this. There's training opportunities that are involved in being able to go to other communities where we're still not peaking, we're still at the bottom of this curve heading up. There's other communities that are at the top of their curve, or they're headed right up towards the top of that curve, and they need help and resources. So the one thing that I know the hospital systems are weighing is the training opportunities to be able to send resources that we have now that are available in terms of human resources to those areas to be able to see it firsthand, be able to have that training and what happens when you're in a peak environment and when the surge is happening. But the other consideration is making sure then, as those areas are winding down, or as our area starts to really wind up, those resources need to be able to come back home, shifted back here. They need to come back home healthy so that they can then manage the surge that's coming here. And then the third consideration with that is the fact that because we're helping other communities who are all in different parts of their curve, we'll then be able to accept resources from other areas of the country and maybe even downstate as well to come up here to help us as we're peaking in our curve in middle or in early to middle May, which is when I think this may come around. So those are the different considerations that are being made as they work through that request and as they make those decisions over the next several days.
Very good. County Executive Bello talking about the curve there, and he had encouraged Dr. Mendoza to perhaps mention his thoughts about the peak and all that. And I think the next question kind of gets to that. It's from Mary G. And she asked this: if social isolation works and test positives end in Monroe County, what happens to the virus then?
Well, Mary, your question hits at perhaps the most difficult question that is lying before us through all of this epidemic. And that is, when will this end? And the reality is, the more we do with regard to social distancing, the further out we push that curve. And potentially the longer this will last. We're not aiming for a particular number. We're certainly trying to keep the number as low as possible. But there isn't a number that anybody has said to us that will tell us then, you know, we've succeeded, that we've beat this thing. And so we're looking at a target that's moving. And if we do well, we will move it even further. But unfortunately, we can't look at numbers that we see today as a reflection of how well we're doing today. In fact, we can't even look at numbers in 2 weeks that will necessarily tell us how well we're doing today. So when we look at these test results, first let's remember that we're not able to test everybody in this community. And so the test results that we are able to report are only a reflection of those who have been able to get the test. And so we will not have a true sense of the community prevalence of this illness until much, much further into this epidemic. And so what I would caution everybody to consider is that we need to keep doing the social distancing because this is the right thing to do, and not necessarily because there's a goal or a number or a benchmark that we have in mind. The reality is that we are still learning a lot about this virus, and we're learning from what others have seen across the globe. There has been hope uttered that as weather gets warmer and as the climate becomes more humid, that potentially this virus will be less robust in the face of those conditions. But the reality is we don't yet know that. We're still doing a lot of research to try to understand that fact. But all of these facts and all the things that we're learning all point to one reality, which is that social distancing is the treatment for COVID-19. And to the extent that we can, we need to all get all hands on deck to do everything we can to fight this through social distancing.
There you go. Dr. Mendoza, thank you. Congressman Morelle, Mary F., one of our viewers, asked this. Has New York State waived the work search requirements for receiving unemployment benefits? Many of us have only been temporarily furloughed, so it wouldn't make sense to have to look for a new job.
Yeah, so that's a really great question, Mary. Let me just step back for a moment, because this is one of the three sort of legs of the stool that relate to families and individuals. I talked about the Paycheck Protection Program, mentioned the rebate checks, which will be coming to everyone. But then there's the unemployment issue. For those businesses who are not able to keep people in place, and those folks will now need to have unemployment insurance, we have an eligibility issue that we've changed, which is the eligibility requirement that people look for work. That's been waived by the federal government, so you don't have to look for work, which obviously makes sense in the midst of this crisis. We also waived at the state level the ability to have to wait a week before you can apply. So you get now unemployment benefits from the first week of being unemployed. A couple other things that I want to mention about it. Under the federal law that we passed last week, the number of weeks that a person will be eligible for unemployment in New York State has gone from 26 weeks to 39 weeks. It's a pretty big expansion in terms of number of weeks. But the really important thing here is that we've added to the state benefit by $600 per recipient. So under New York law, the maximum you can receive in unemployment benefits is $500, 2/3 of your paycheck, or $500, whichever is less. So what we've done is add $600 to that. So if you receive the maximum New York State unemployment benefit, your weekly benefit will go from $500 to $1,100, pretty substantial increase. And if you made, for instance, $300 in unemployment under New York State law, you'd get $900. Add $600 to whatever your unemployment benefit will be. So this is a really, really important part of this work. I do know, after conversation with my friends at the state level, there has been a huge influx in the number of people who have applied and are applying for unemployment insurance. You see this across the country. So we're trying to work on some of the technical issues that dealt with the website and the calls that have to go in to be able to qualify. But again, if people have questions about it, it's a really important program. It's an important part of keeping people and families whole. So we would encourage you to call our office or the State Department of Labor if there are issues, and you can certainly go to our website as well.
Very good, thank you. Our next two questions have to do with age. One is linked to the stimulus package. The other is linked to the victims of COVID-19 in our area. We're going to get to those two very important questions straight ahead. Welcome back as News 8 is continuing to put facts first. This message is for Congressman Joe Morelle, and it specifically has to do with the age requirement for the stimulus. This question is, a majority of college students aged 19 through 24 will not be eligible for the $1,200 federal stimulus check, with a majority of these people working in sectors temporarily shut down due to the virus. What would you say to those who are currently out of work and not receiving pay? How are these people supposed to pay bills?
Well, it's a great question. This relates to the rebate check, which children 16 and under are qualified to have their families get $500 for every child. But for people 17 to 24, they don't receive it under the bill that the Senate advanced, which we passed in both houses. I am currently co-sponsoring a bill with my colleague Angie Craig from Minnesota that would raise the age cutoff to receive the additional $500 per child from 16 to 24 to help support those families. If you are a college student who files your own tax returns and are not a dependent, you do get the $1,200. But obviously, that's a relatively small amount. So I think the legislation, which I'm co-sponsoring with my colleague Angie Craig, as well as looking at other ways that we can help college students, is going to be a priority in the next bill I think that we're about to take up. And to be clear, we've done 3 bills. We did the emergency appropriations. We did a bill that dealt with sick and paid family leave. The 3rd bill, which I'm talking about tonight at some length, is the $2 trillion CARES Act. But there is going to be more help, and I think when we look at what we've done to date, we're going to see gaps in places where perhaps we hadn't thought of, or places where we couldn't get agreement with the Senate. But this is going to be a priority. We're going to continue to work on this. You'll hear more of this in the coming weeks.
All right, Congressman Morelle, thank you very much. Out of all the questions that we received over the last 2 days, we got this one the most. And I'm going to cite Barbara and Debbie, 2 different News 8 viewers, but there were many more asking something similar. And this one goes to Dr. Mendoza. Why isn't any information like the age or residence of the people who have died from COVID-19 being released? So again, this question is going over to Dr. Mendoza.
Well, thank you for the opportunity to address this question, because this is something that I have heard a lot of feedback about as well. So first, let me start by saying that one of the most important priorities in my role is to do everything I possibly can to protect the health and safety of our public. And I will, make no mistake, release information when, in our estimation, it will make an impact on our ability as a community to improve our health and our safety. At the same time, as a physician, my first responsibility is to do no harm. And I know, after having spoken to a number of the families who have unfortunately gone through a very difficult time, that the last thing I want to do is do anything to disrespect them in this awful time of need. And so if you can imagine, tomorrow, if we released a number and a gender, and you happen to know somebody because you know through social media or some other source that somebody with that age and gender is in the ICU, you might naturally wonder if that was the person who passed away. The reality is that we do not want information about the passing of a loved one to be something that is spread through rumor and hearsay and social media. We want that message to be something very personal that resides within the support of a family. And so while I can appreciate the interest and the curiosity, in my view, there really is no public health benefit to reporting age and gender of somebody who's passed away in real time. That being said, I'm very open to finding ways to report these data in an aggregate way, in a way that does not threaten to identify anybody in a real-time fashion. And so, we'll look ahead. Unfortunately, we don't think we think the deaths will continue, unfortunately. And as we find ways to report on data in an aggregate form, I'm certainly happy to consider that.
Very good. Dr. Mendoza, any final thoughts as we wrap this hour up?
In closing, all I would offer is that, as I've said many times before, we are in unprecedented times. We are asking of all of us in the community to take steps that feel very unconventional, very unsettling, and to some people even very scary. And make no mistake, I join you in this. This is new to all of us. And at the same time, we also need to recognize that there are some steps that we can all take, social distancing being the most important. remembering that this is an infection that is transmitted from person to person. So maintaining 6 feet of distance, that Bill Maley of distance, if you will, is probably the most important thing that we can do. If you're sick, please stay home from work. Don't take the risk of getting somebody else sick. And last, and certainly not least, the most important advice, again, is to wash your hands and do everything you can to avoid touching your face, because that is what we know to be the most common pathway to becoming infected with COVID-19.
Dr. Mendoza, I want to thank you for joining us and for that final thought. We're going to move over to Congressman Morelle. Congressman, anything that you'd like to leave our audience with this evening?
Well, first and foremost, Adam, thank you and WROC for hosting what is clearly a very, very important conversation. I also want to thank the county executive, a longtime dear friend, and Dr. Mike Mendoza, both who have done extraordinary work in the last several weeks and will continue to operate at the highest levels of excellence. I want to thank healthcare workers, our law enforcement community, grocery workers, transit workers, and everyone on the front lines of this global pandemic. Even in the darkest times, I'm always reminded of how truly special our community is and what a great privilege it is to represent this community and to work side by side with people who are making a difference every day. And throughout all of this, I've been thinking of the inspiration that comes from Fred Rogers, who seemed to have the answer for so many things. And he talked about how in scary and uncertain times we must look for the helpers. You're always finding people who are helpers. It's been humbling to see the amount of helpers in our community who come together, uplift one another, and are working together in this incredibly unprecedented challenge. So I'm profoundly grateful for the patriotism of people in this community. I hope everyone takes time to think about how they can be a helper to someone in this community, because it makes a big difference. Let's keep our community safe. Let's flatten the curve. And again, thank you for the invitation to be here tonight. It
is our pleasure. Congressman Morelle, thank you for making the time. I know that your schedule in particular is especially busy, given your travels back and forth to Washington, D.C. to sign such important legislation. We want to end with the closing remarks of County Executive Adam Bello. Mr. Bello, a lot of people have been turning to you for answers throughout all of this, including your staff. And in a way, many of them are on the front line.
They are, and I want to thank my team in Monroe County, each and every one of you. Whether you're an essential employee and you're at work and I see you, or I don't see you because I can't see you, or you're home right now, we value all of your hard work and everything you're doing to protect and keep us safe, whether in law enforcement, public health, or wherever it is that you're working. I want to thank you on behalf of a grateful community, to my entire team, all 4,500 of you. That call Monroe County home. I also want to thank particularly Michael Mendoza, Dr. Mendoza, and his team at the Department of Public Health. I got to see them in action the day and the night that we got word of our first case here in Monroe County, which feels like it was years ago, but it was just a few weeks ago. Those are some of the hardest working people, men and women, that I've known in my entire career, and I want to thank all of them who I hope are watching this tonight and let you know how grateful we are. Dr. Mendoza and I didn't even know each other 4 months ago, and we are working side by side right now, and this community is lucky to have him working in the Department of Public Health, and we're lucky to have Congressman Morelle here, because there's not very many communities across this country where you see the coming together of the federal, state, county, and local governments in the way that you have here in Monroe County. And I want to leave residents with this message here, and it's something I said at the beginning. I know it feels to a lot of us like we're stuck at home, but I want you to start thinking about it as we are safe at home. This is how we're protecting us, those in our community. This is how we're protecting the health of the vulnerable people in this community, because this isn't about me. This isn't about Congressman Morelle or Dr. Mendoza. We'll be fine. The vast majority of people watching this who contract this disease will be fine. This is about the elderly people in this community. And I want you to think about the curve a little bit like this. As the curve goes, if we do our job and we flatten this curve, it's going to take it out a little bit. It's going to take it a little bit longer, but it's going to save lives in this community. And as we ramp up, think about this. If it doesn't hit until early May or mid-May, what we're doing today and the social distancing techniques that we're following to and the professionals we're listening to today will affect those people on that curve, because it'll affect who gets sick. The folks who are at the peak of this curve in Monroe County haven't even caught the virus yet. by and large, haven't even gotten sick yet. So every action that you take today will impact each one of those individuals who could potentially become sick over the next 6 to 8 weeks in our community. So you have the power in your hand here at home to change the course of history in Monroe County, change the course of how this virus spreads through our community. And you can do that by staying home and by being responsible about how we go to the grocery store and being responsible how we check in on the vulnerable amongst us, but protect their health first and foremost so that they don't become sick. So I want to thank you for your cooperation. I know this isn't easy. This is not something any of us have trained for, but we are going to get through this because we're going to do it together, we're going to do it as a community, and we're going to come out on the other side.
Very good. County Executive, thank you. Thank you, Congressman. Thank you, Dr. Mendoza. While I'm thanking people, I'd like to take a quick second to thank the News 8 team. A few weeks ago, it was business as usual. Now, something completely different. And every single part of this team has stepped up, and I could not be more proud. Thank you as well for watching us and putting your trust in us. This concludes our special edition of News 8. As always, you can find more over at rochesterfirst.com. Have a good night.
This is a special edition of News 8 Coronavirus Facts First Town Hall.
Good evening. Thanks for joining us in this special digital-only half hour with our local leaders as we talk about COVID-19. With us, we have Congressman Joe Morelle, Monroe County Executive Adam Bello, and we have Dr. Michael Mendoza. He's the Health Commissioner here in Monroe County. The first question is going to go to Adam Bello. County Executive Kiana asks, why hasn't there been an enforced lockdown of Monroe County? There are businesses like fast food, bars, and restaurants which are open for delivery, drive-through, and takeout. That doesn't make sense to me.
No, that's a really good question, and I think the answer lies in the fact that there are still some businesses in our community that are providing an essential service and a function for the community, and one of them is providing access to food. So while it's incumbent upon them to remain open and be able to continue to have that line and access of food available to the community, it's also incumbent upon us to make sure that we're using those services in a responsible way. It can be done safely if following the Monroe County and New York State Department of Health guidelines and the CDC. My family, I could tell you just last night, instead of choosing to go to the grocery store, we did get takeout from a Chinese restaurant yesterday. And I think we were able to do that in a safe and effective way, supporting a local business, but also being healthy about it. So I think we should do that, but we also have to make sure we're doing this responsibly, because I get this question a lot about essential businesses and how they're being used by our community. And we need to be responsible. When you go to the store, to the grocery store, if you're going to Wegmans, Tops, Aldi's, or wherever you're going, you have to reconsider this, whether or not your entire family has to go with you. If you're in a position where you can go by yourself, you should go by yourself. You shouldn't bring the whole family if you don't have to. We should be thinking about when we're going places, like I know Lowe's and Home Depot are open as well, because they're providing an essential service to many homeowners and businesses in our community. But before you go to Home Depot and Lowe's and expose yourself to the employees there who are on the front lines of this pandemic themselves by working in an essential business, think to yourself, do you really need to be going to Lowe's and Home Depot today? Is it really an essential function that you need for your household or for your business? So we have a responsibility in this as well. The workers who are the front-line workers in these essential businesses are providing an amazing service to us, and they're putting their own health and their family's health on the line. And I do think we have a responsibility as consumers of those essential services to make sure that we're asking ourselves, while we're putting ourselves out there, are we putting people needlessly in harm's way? So we need to do this responsible, keep that 6-foot distance between each other, and also cut down on the number of people who are going out. If you're in a position where only one person needs to go, only one person should go.
Very good. County Executive Bello, thank you. It's amazing to think that despite COVID-19, a lot of big issues continue to roll on. One of the bigger ones is the census effort. So I'm going to toss this over to Congressman Morelle. Where does the census now stand? One specific part of that, are people still going door to door?
Well, it's a great question. The U.S. Constitution requires that we do a census every 10 years, partly so that we can appropriately apportion the different congressional districts around the United States, but it's also very important to us in terms of how federal dollars are distributed. Yesterday, Adam Bello and I both did our census forms online. Yesterday was National Census Day, but we also noted that $675 billion in the United States budget is determined in part on where you live and how many people live in particular communities. So it's really important. But we've made some changes. First of all, we've extended the deadline for the census until September to give people more time to do it. But I would strongly encourage people to go online so we can avoid people coming to your house to take the census, which could happen. Obviously, we want that to be avoided to the greatest extent possible. So people should go to my2020census.gov, my2020census.gov, and you can fill it out online. It takes literally about 10 minutes for anyone to do it. It's one per household. And you should have received in the mail a blue form from the United States Census Bureau. It is a requirement. Everyone who is a resident of the United States has to fill one out, so it's required. But you got that form in the mail. It'll have a unique code on it. When you go online, you simply put in the code. It pops up, and within 10 minutes you get it done. So please, 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 it's really important. The Constitution requires it. The apportionment of members of the House of Representatives is based on it, and two-thirds of $1 trillion will depend on those census forms being filled out. I think the county executive and I looked yesterday. Monroe County recipients or residents have filled out about at the national pace, maybe a little bit ahead of the national percentage. About 39% of Monroe County residents have filled it out so far. We obviously want to get to 100%. Everybody needs to fill it out. We are extending the deadline, but the online system just allows people to avoid having folks go door to door.
Very good. A little competition, I guess, never hurt anybody. Thank you, Congressman. Deborah's question is really a lot of questions, and this is for you, Dr. Mendoza. She packed in a lot, so we're going to go through this here. Where are we with COVID-19 testing? Who's getting the tests? Do we have the needed tests and materials to get a true sense of how many people in our community have it? And lastly, what's the turnaround time to get results from the tests that are being conducted?
Well, thanks, Deborah, for that question. And testing is a hot topic. And I will start by saying that we are not where we would like to be. We are in many ways behind in terms of testing. If there was a way we could have tested far more people by now, that most certainly would have been the path that I would have chosen. That being said, here we are. We've got to do the best that we can. We are testing in this community right now between 100 and 150 people a day, which again is not enough. but we are testing those individuals for whom the result will make a difference. And again, those are people who are in the hospital, because when we know that somebody is positive or negative for COVID-19 in the hospital, that will greatly impact the type of care and the precautions that we might need to take in order to care for that person. The reality, unfortunately, is that we're not testing enough people now. We do know that there are more supplies on the way, and within the next week or so, my anticipation is that we'll be able to test more like 200 to 300 people a day. Again, not enough, but we are certainly making some progress. That being said, let's put the test results in perspective. The reality is that we can't judge our success based on the numbers of tests that we're ordering, or frankly, even the results of those tests, because we need to assume that all of us in this community is at risk for conveying this infection to somebody else. We need to all assume as though we have been exposed and that we might get somebody else sick. And so because we don't yet know the full numbers, I've suggested in the past, and I will say it again tonight, that the hospitalization rate, the number of ICU patients we have admitted, and the number who are receiving mechanical ventilation are the numbers that we need to be tracking, because those numbers speak more directly to our ability to sustain care for these individuals, our ability to look ahead and prepare to make sure that we have the necessary resources, and quite frankly, there are a better measure of the true burden of illness. We know that approximately 80% of people who get this infection will not have any symptoms or will have mild symptoms at most. Those are the individuals that we don't necessarily need to test right now, but we need to make sure we're testing those individuals for whom the result will make a difference. In terms of the turnaround time, again, a complicated process. We know that the tests that are done here in our labs at both Rochester Regional and at the University of Rochester will come back within a day. We also know, because of the shortage of testing supplies locally, a number of these tests are being sent away to what we call reference laboratories, and these laboratories are all across the country, and they are also strapped for supplies. And so those results are coming back anywhere from 5 to 12 days later. And so when we report the daily results, you'll notice that they don't necessarily reflect the tests that were ordered yesterday. Very often, as was the case earlier this week, the tests that we received on Tuesday were the result of tests that were ordered in the 7 days prior. And so again, the moral of the story is that we cannot hang all of our hopes on the availability of tests and the results. We need to be looking at this with a long view and focus our social distancing effort with that long view in mind.
And Dr. Mendoza, am I correct in my observation that up till this point, over the last 2 weeks, the ICU bed rate has stayed pretty consistent, right around 20 to 25?
It is true. The percent of individuals who are admitted who are in the ICU has remained relatively constant. Again, though, I will say that that rate is somewhat subject to us being very early in this epidemic. We know that when there is capacity in a hospital, we might admit somebody to an ICU, even though in 3 weeks we may not admit them to the ICU because the circumstances are different. And so let's make sure we look at those ICU data with a little bit of sophistication. But it is true as of right now, in fact today, the proportion of admitted patients in the ICU actually went down. So again, these are steps in the right direction, but we have to be looking at this with the long view in mind.
Very good, Dr. Mendoza, thank you. County Executive Bello, Eric asks, is there anything I can do to help local people or businesses affected by the economic problems caused by this pandemic?
Sure. Eric, that's a great question, and I think it reflects the selflessness that a lot of people in this community feel and how they want to help. I would start by saying this. As it came up in a previous question about being able to patronize local businesses who are essential businesses and providing that function, the answer is yes, you should patronize restaurants, things like that, that are providing those takeout, providing those delivery options as well. I would also suggest buying gift cards from stores or businesses that can still do that online. Most places offer that online. So I think there's still plenty of ways that you can patronize local businesses without having to go there yourself in person and do that. There's a lot of online activity for that. So I think the other way to help, though, is, again, I'll go back to the United Way of Rochester and their volunteer portal. At uwrochester.org, we're in need of a lot of help around this community, and this helps people who were impacted even in their businesses by COVID-19. And I'll specifically point out two, though. that could really use some assistance. We're looking at FoodLink and Lifespan because they're providing food to vulnerable people in our community, and they're providing check-in and daily support to older residents in this community as well. And so really what you need to do, I think, is to think about outside of who's really most impacted by this. We have our local businesses that are still open, the ones that are open, that are taking online by phone, and things like that, and for delivery. You should also be looking at vulnerable people in our community and how you're checking in with them. There's a way to do it in a socially distant, responsible way. If you have neighbors on your street who are older, we should be calling them. Call them daily. What do you need? So if you're getting supplies, and I know early on in this, a couple weeks ago, there were folks stockpiling supplies from Wegmans, and while it's always good to have a cushion in your home, I don't know that we need to stockpile supplies. What we need to do is get what you need for your family to get through this. But then you need to figure out who are those vulnerable people on your street who can't go to the grocery store safely because they're the ones we're trying to save and protect their health. Find out what they need and what you could leave on their front porch to help them get through the next couple weeks, because not everybody has that same opportunity to go to the grocery store or to patronize a local business. The other thing I'd like to say too is that if you are a local business, or if you have been impacted by a closure from a local business, you've lost your job, you've lost employment, or if you're a local business that needs to staff up. We've seen some stories about hiring taking place at different businesses. We've created, by working with our partners at the Chamber of Commerce and the Greater Rochester Enterprise and Rochester Works, we've created a portal, an online portal, that businesses who are looking to staff up and have openings can register through there and post those openings there. And then if you are looking for work yourself, I would encourage you to go to that portal and see what job openings there are. So again, we're trying to create that collaboration between all the different economic development agencies and the businesses in our community into one place so that there's a one-stop shop for that, and you can get to that portal through our website at monroecounty.gov.
County Executive, thank you. Next question is going to be for Congressman Morelle. Christine appears to be in the medical community, and she's asking this question. What can I tell my uninsured patients who are not seeking testing and care for COVID because of the potential costs?
Well, Christine, it's a really important question. And I'll put a shameless plug in for this. This is why universal coverage is essential in my mind, and we need to get in America to a place where everyone is covered. It's what the Affordable Care Act wanted to do with the individual mandate, because whether we could foresee a pandemic like this happening or not, no matter how young you are, no matter how old you are, there's always a possibility of coming down with an illness. But for the immediate question, let's just note a couple of things. Testing, if you need to be tested, if you have symptoms and a test is ordered, that's covered. It's free to consumers, so if you're covered, your insurer will pay for the cost of testing. If you're not, if you don't have coverage, there's a waiver of the charges. So no consumer will pay out-of-pocket costs. That's something that we did in one of the earlier packages that we did in Congress. New York has reopened enrollment in the health insurance marketplace, so people can go look to buy products through the New York State insurance marketplace. So that's something that we typically only do at certain months of the year, but the governor has ordered that to be open. I will say that we in the House fought for a proposal which would have covered uninsured patients, not only for testing, but for the treatment and any costs associated with COVID-19. Unfortunately, in our negotiation with the Senate majority refused to agree to that, so that got taken out. We do have dollars, I mentioned $150 billion going to our hospitals and healthcare systems around the country. Some of that will be used to help pay for those folks who are in hospitals that are uninsured. But this, again, I think is something we're going to continue to look at. We hope businesses will avail themselves of the Paycheck Protection Program, and that way they can keep employees on the payroll, continue to pay health care benefits if they do that, and allow that coverage to continue. This is a really big problem. We'll continue to monitor it, though, because when we go back to do additional legislation, this is certainly one of the areas that we're going to look at very, very carefully and see if there is an additional federal support that we can provide.
Congressman, thank you. There's so much talk about vaccines, and that's the big one. That's the big white whale that everybody's trying to get. But there's also testing to see if people have COVID-19 and testing to see if people have had COVID-19. Lastly, there's a lot of talk about treatment. because that can help keep people out of the hospital. And Tom has a question about one particular treatment, but his is more of a concern. He says this, and this is for Dr. Mendoza. I heard that taking ibuprofen for COVID-19 actually makes it worse, and you should take Tylenol instead. Is this true?
Well, thanks for your question, Tom. We read this as well. Those of us in the medical community saw these news headlines go by, and we were wondering the same thing. But it turns out that according to the CDC, according to numerous sources of valid medical advice, there is no evidence that says that ibuprofen will do any harm to an individual who's trying to treat the symptoms related to COVID-19. That being said, I think it's important for you to make sure you consult with your personal physician, your healthcare provider, because everybody's circumstances are different. And the reality is medicine is complicated, and it's quite possible that the guidance that we learn today may change tomorrow. And so while I can offer this advice to you today, I think the most important thing to do would be to ask questions. And as a physician, I welcome these questions. I love it when my patients go to the internet, find something, and ask me about what they've learned, because it's an opportunity for us to provide education. So thank you for your question. It's not a stupid question at all. It's a question that many of us have had. But again, at the bottom line is to make sure you consult with your personal care physician about your medical care.
All right, very good. We're going to flip this one right back to Congressman Morelle. Artis is asking this. With evictions being suspended, what will happen if people stop paying rent during a 90-day period? Will that balance still be expected? I know a lot of this is being worked out at the state level. I'm guessing or hoping that you're aware of some of this so you can address her concern.
So the moratorium right now is on foreclosures and evictions, which goes for 90 days. It is a state foreclosure eviction moratorium, so the state will have to make a decision on whether they want to continue this should conditions persist. But at the federal level, what we really took the approach, and I think I've sort of commented on this during the past hour or so, that through the Paycheck Protection Program, through the Enhanced Unemployment Benefit Program, through the rebate program, our goal was really to try to get dollars in the hands of individuals and families so that they can continue to meet their payments. So where the moratorium exists at the state level, that's just a deferral. That's not a deferral on rent. It's just putting off evictions and putting off foreclosures. But you still have the obligation, which is why, to the greatest extent possible, make use and avail yourself of the programs that we've done at the federal level, which really go to families, individuals, small businesses, helps keep the revenue that's lost because of the virus, keeps that coming to people so they can continue to meet those bills and they don't get behind on payments, et cetera. So that's what we strongly urge people to do. The state will have to make a decision on foreclosures and evictions and whether they want to keep that moratorium in place going forward.
Very good. I'm not ignoring you, County Executive Bello. I do want to get to Dr. Mendoza for this next question, and then we'll flip things back to you. This is from Chris. Is the health department tracking non-hospitalized cases? And if so, what is the data showing, suggesting about prevalence trends in the county? And if I develop symptoms, but they are not severe enough to warrant testing, am I supposed to notify the health department?
Well, Chris, your question gets at the heart of what we do in public health, and that is surveillance. Surveillance allows us to understand the true prevalence of an illness in a community, and ideally, it will inform our ability to prevent future illness. Unfortunately, because this is a novel virus, a virus that the world has not seen until now, our ability to prevent is quite limited. What's also limiting our ability to prevent and anticipate is, again, unfortunately, that we're not able to test all of the people that we would otherwise want to test. That being said, we do understand a little bit about the prevalence right now. Through the people that we are testing and whose results are coming back positive, we call those confirmed positive patients. We are also doing contact tracing for all of the people who have been in contact with that person, and whether we test them or not, the reality is that we conclude that they are presumed to be positive. And so we have quite a bit of data across those various variables. And the reality that we know now is that even though that we're not testing all the people we would like to test, this illness, this infection, is all across our community. It is spanning every age, every demographic, every socioeconomic level that we can think of. And we will do more studies, we will do more data crunching to understand that reality better in time. But right now, our emphasis is in trying to contain as best we can and to try to prevent future infections. As to your question about whether what you are supposed to do when you have symptoms, the first thing we want you to do is make sure that you're not suffering in silence at home. If you feel unwell, if you feel to the point that you need to go to the emergency room, please call 911. At the same time, we also know that the vast majority of people who come down with COVID-19 will not have that degree of severity. And so please be in touch with your healthcare provider. It is okay to wait 3 to 4 days. Even though you have a low-grade fever, it is okay to wait 3 to 4 days before you contact your healthcare provider. And if you do contact them, report your symptoms, report any risk factors that you may know of, particularly if you know that you've been exposed to somebody with a confirmed infection, and realize that you may not get tested because, frankly, it is unlikely to change your doctor's mind as to how they're going to proceed. We are always welcome to hear about you. You can email us at covid19@monroecounty.gov, and we'd be happy to put you in our database. But at the end of the day, there's going to be a whole lot of data gathering and surveillance that we're going to be doing in the months and years to come.
Dr. Mendoza, thank you. County Executive Bello, I like the message that you gave just a few minutes ago. Instead of thinking about it as staying at home, you're saying stay safe at home. And that particular message has a few questions that can orbit around it, and Diane picks up on one of them. She says, when the governor says stay at home, can I still take walks, go out for a drive, have my grandkids over for an Easter egg hunt in my backyard as long as I am 6 feet away? Can I talk to a friend sitting a distance away? Or would these things put me at risk because I'm over 60?
Well, Diane, thank you for that question. I know a lot of people are thinking about this, and that includes me and my family as well. When the governor says stay home, what he's really talking about is making sure that we provide the right social distance so that we're not spreading the virus between us. So can you go outside and take a walk? Absolutely. I take a walk almost every day with my family, my kids, and the dog. But we got to do it because our physical and mental health is critical as we get through this. But you have to do it in a safe way. So when we're walking down the sidewalk and someone is coming this way, I think a lot of us are already doing this, but you have to start to distance yourself as you come up. Get on the opposite sides of the sidewalk. Make sure we're 6 feet, a minimum of 6 feet away. Still wave and say hello to our neighbors, check in on our neighbors, but you do it from 6 feet away. You know, I ran into this issue a few days ago. Someone said, well, I still go for walks in the morning. It's not a problem. I'm still socially distanced. It's still my same walking group of 3 or 4 people I've always been walking with. That, unfortunately, is not social distancing if you're not with the same people who are living in the same house as you and you're still meeting up. You have to do it from a 6-foot difference. And while I know my parents and my in-laws, who I love dearly, who are probably watching this, will not like the suggestion that I'm going to call them older residents, I love them dearly, and I want to make sure that they're safe and protected as you want yourself to be safe and protected, and your parents and your grandparents as well. And so when it comes to activities like Easter that's coming up, and I know this is breaking my own mother's heart, that we're not going to be able to get together as a family like we usually do. We're going to come up with other ways, though. So it's not that we're stuck apart on Easter. We're going to stay safe on Easter, and we're just going to do it a little bit differently. Can we do it through a Zoom session? Can we remotely look at each other and see each other and talk to each other and celebrate with each other as if I know it's not the same as being in that room together. I get that, but it's at least a different way of doing it, and maybe try to have a little bit of fun with the kids in doing it that way as well. So we're going to have to figure out how to do these things differently. But if you're particularly an older resident in our community, if you're over 60 years old, Dr. Mendoza may put a different number on it, maybe if you're over 50 years old. If you're an older resident, if you're otherwise, your health is otherwise compromised, or you have other conditions, now is not the time to think about, can I get away with this or can I get away with this? Now is the time to think about, how can I do this in a safe way? You got to think about how to do it differently and start to change our mindset. And that's going to be difficult. It's going to be tough, particularly around the holidays. But I'm also looking for ways that I can, lead by example and show people how to do that. And I think that you should go to social media and show people how you're doing that. Just last night, we had a great outpouring of support from around the community of folks putting candles and lights on their front steps in support of healthcare professionals around our community. And those pictures were everywhere on social media. They were certainly all in my news feed on Facebook and Twitter and everything else. I would encourage you to do the same thing as we're thinking about holidays, birthday celebrations, graduation parties. How can we do them a little bit differently to, instead of saying why we're stuck doing it this way, say, why don't we get to do it safely this other way?
Very good. In fact, there is a hashtag. It's hashtag doing my part ROC, and if you go check that out on Twitter, if you have Twitter, you can see what other people are doing. And when you do something, as the county executive just suggested, perhaps share it, take a picture, let people know, and then they can follow suit and continue that safety as we go forward. And again, I do love that. Stay safe and stay home. All right. This last question is for Congressman Morelle. This one is from Maria. Does the federal stimulus package provide paid sick leave for an essential worker who contracts COVID-19? If so, is my employer required to pay it, or will the federal government?
So it's a great question. Under the second of the three bills that we passed, the Family First Coronavirus Response Act, we put in place for essential workers that they would receive, people who contract the disease, who come down with COVID-19, that paid sick leave is mandatory, will be paid by the federal government through tax credit. So your employer pays it, they get a tax credit that's refundable, and that will be paid by the federal government. So it's really, really, really important. And I just want to also echo something the county executive said, because social distancing is hard. It's especially hard for politicians. Especially hard for politicians who happen to be Italian Americans, because we hug and kiss everyone. So let's be honest, this has been really, really difficult for me. And in some ways, it's going to take an emotional and mental toll on all of us, because we're social animals. So I think we need to be mindful of it. I think the suggestions the county executive made are really, really important. But let's get through this. Let's maintain that social distance so there'll become a time when we can hug and kiss once again.
There you go. Congressman, thank you so much. We thank you for submitting all of these wonderful questions. They elicited wonderful responses. We got a lot of information out there because of many of you. I want to thank our panel of sorts for this town hall right now. We have Dr. Mendoza with the county, Congressman Morelle with the Congress, and County Executive Adam Bello. All three of you took time out of your very busy schedule to join us here to get this information out, which I think is so vitally important. So thank you to the crew there, and thank you for watching this digital special here on News 8. We will continue to put facts first tonight, tomorrow, and in the weeks to come. You can watch it on air, or you can go to our website, rochesterfirst.com. We have a whole host of resources there to help you out. Again, thanks for watching. Have a good night.